2, 1, go.
Hello, everyone, and warm greetings from Delhi Gynae Forum South. Under the guidance of Sharda Jain ma'am, Sangeeta ma'am, Renu ma'am, we are doing this very important session on examination, which will be followed by the video demonstration also on the examination of a rape victim or a sexual assault. Though we don't see so many cases in a private practice, but yes, as just before this webinar began, we as faculty members were discussing, we are not supposed to refuse any patient and we have to see the patients. So with this webinar today, we'll become more wiser in our examination and hopefully will not miss any steps. And with this, we go ahead with our scientific session. And I request Renu Mishra ma'am, welcome to give a welcome address. I'll just share the screen, share screen and.
Thank you, Shalini.
Yeah, I'll just share the screen and share your CV, ma'am.
That's okay. It's all right.
Yeah. So, ma'am.
That's all right. You don't need to read the CV. Thank you, Shalini.
Ma'am is a great academician, no doubt about it. And
yeah. There are bigger ones here, so that you don't have to.
The learning never stops, ma'am.
Yeah,
we learn from each other.
Absolutely. So a very warm welcome to all of you who have joined today's webinar. It's an unusual theme for a webinar today. Like Shalini said, that we're going to talk about how to examine a rape victim and what are the medico-legal perspectives that we should be aware of. Because though fortunately it doesn't happen every day that you see a rape victim, but when it does happen, a lot of us, particularly in the private setup, are very hesitant because we are really not sure what is to be done. And unfortunately, I can't remember in my PG days or any time that anybody actually teaches you formally what samples to be taken, what needs to be documented when you have a rape victim. And it is so important because what you put down in the MLC, what samples you take as a primary physician who examines the rape victim may actually finally decide whether she gets justice in the court. So it is very, very important for all of us to know what is to be done exactly. And that is why we have organized this with the blessings of Dr. Sharda Jain ma'am. And we're really blessed that she is with us here. And in fact, the more I see Dr. Jain and listen to her, I am really amazed, ma'am. मुझे लगता है ऐसे चलता फिरता encyclopedia है जैसे, you know, like the depth and expanse of knowledge probably you have acquired in so many years, but it is really amazing. You really never fail to amaze me. So, ma'am, with this, who better than to kickstart this this session? Dr. Jain, ma'am, you are muted, ma'am. So, can we have a few words from you to start this session?
Thank you. मेरा ये CV हटाएंगे, please. I would like to begin today's teaching session with an emphasis on medical examination of a rape survivor in the pursuit of justice. We all know that a sexual assault is a heinous crime, and this assault has been taking every 15 minutes. And not only it causes a great physical and emotional trauma to her, but I think this is a big challenge that her recovery and justice, whether she properly gets it or not, is also to be questioned. What I feel is that today's session will empower all gynecologists how to do the examination. And because your examination plays a very pivotal role in ensuring the justice. I think, you know what, we need to have a lot of empathy as far as this particular victim is concerned. Firstly, we need to recognize that it is a violation to her individual bodily autonomy and her personal integrity. And at the same time, it is a kind of a lifelong trauma which she has. I think it is not very easy for her to recover. During this particular process, you realize that, you know, when we highlight the steps, the documentation of the injuries sustained had to be highlighted by the person who is examining this particular patient. At the same time, you know, previously it was necessary those injuries should corroborate with her statements. But now her statement is the ultimate. Even if the injuries are not there, it does not mean that patient has not had a problem. Secondly, is that looking at the injuries, you can definitely timeline when this particular incident has happened. Collection of forensic evidence is very important for DNA as well as for forensic evidence, and because this will only link the perpetrator to the crime, and DNA diagnosis will be irrefutable proof that this gentleman had been involved in this crime. Preservation of evidence is also equally important, that they do not, you keep them in a proper place so the samples do not deteriorate. And at the same time, because not only we take samples from the body fluids, we take samples of the hair, the clothing, and we need to be very meticulous as far as taking samples are concerned, and at the same time, putting them in a proper envelope and labeling them. At the same time, not only examination is important and collection is important, you have to do medical care for this particular victim, because her health and well-being is also equally important. Not you have to take care of her any physical injuries. At the same time, you have to see to it that you give her prevention for sexually transmitted diseases. At the same time, you make her feel that you are empowered, and the society is committed that this child should definitely get the justice. And I think each one of us should take this medical examination very meticulously. Here, I just wish to tell you that this was made when I was president of the chairperson of Women Wing of Indian Medical Association. This was way back in 2004, 5, and 6. This film took a year-long time, and this was released in 2006. And this was done with the help of Government of India as well as UNICEF. And all this while, so many things happened. Nirbhaya case came, and Justice Verma's report came, and the government became very serious, and the government also brought the guidelines and the report in 2014. Then a friend of mine who happens to be Delhi State Indian Pediatric Society ki president, she told me in 2023, Dr. Jain, lot need to be updated, because your film is the only film which is being used across the country to train the medical officers in evidence collection. And but ab main soch rahi hu ki aapka jo hai 1/3 of it has to be changed again. So I said, look, that time the UNICEF gave us 10 lakhs of rupees to the IMA, so we could make the film, but that kind of money we do not have it now. But then I asked Dr. Sangeeta. Sangeeta has been a part of us that time. She told me, Dr. Jain, I think, we should be able to do a good job. It involves a small money. So I called the person, how much money will be there. Anyway, finally, the film is in front of you, and you'll be able to see that a lot of change has taken place, but at the same time, we have kept the original thing. So we did not have to really do many things. But I'm sure this is a gift of myself, Sangeeta, Dr. Gaurav, not only to the whole country, as far as the medical examination is concerned. And you'll be surprised to know that not only this film is used in our country, it is also used in neighboring country as for the examination of rape victim is concerned. So with these particular lines, I think, today's session will definitely go a long, long way in empowering yourself. So thank you very much. A special thanks to Shalini as well as to Madam Renuji persuading me to be here.
Thank you so much, ma'am, for your kind words. Like we all said, we all agree, you truly are a source of inspiration for all of us. And I've already seen this video. This video truly is amazing. So with this, I now request Dr. Meenakshi Ahuja. Ma'am is the Senior Director at...
I'm not going to have my CV, please. I think I'm home and DGFS is my home, so I don't think I need an introduction here. Thank you so much, Shalini, and thank you, Dr. Renu, for giving me this honor. It really feels so great to be, invited as a guest of honor in our own forum, which we've enthusiastically, all of us have worked together for so many years. I think the only thing which I would like to add, there's barely anything to add after Madam Jain has spoken. But what I would just like to say that when everyone else was saying that we've not seen cases and we don't have that often, we have to understand that now with consensual sex also, increasing at a younger age and otherwise also. And the very fact that women know that they are empowered and no means no. We are probably going to be seeing much more of this, because at the end of the day, they are partying, their kids are out late. And when, unfortunately, the girls get into this circumstance, I think we as gynecologists, when we are confident, we will be able to give women more confidence that they can report these heinous crimes. Because at the end of the day, I think we still touch the tip of the iceberg, and we have much more rape going out in the city, in the country, than that is reported. So once when they also know that we are going to do a thorough job, and we are going to take care of them physically, emotionally, medically, and in all forms, then probably we will also, our work is only going to increase in this segment also, unfortunately. So all of us need to be forearmed and forewarned and take care that we are, dealing with this very empathetically, very sensitively, and yet completely. Thank you so much.
I wish to inform everybody that Dr. Meenakshi has taken over as the president of Delhi chapter NIGF is concerned. It's a very big responsibility. People like us never reach that particular level, but I am glad, that, that our colleagues are reaching there.
Congratulations, Meenakshi.
Yeah.
Thank you so much. But I think, our power is in our numbers and in our unity. So I think that is one thing we should never forget. So when we get so much knowledge, so much, I think as far as anemia is concerned, cervical cancer prevention is concerned, we are doing so much work, the obstetric critical course and our medical legal cells. We have helped and we have so much knowledge, and we all want to be part of it. We should take that use all of it, and all of us should always remain together, so that we, that's only that you become a strength to be reckoned with. So I'm really looking forward for Delhi Gynae Forum South and for Delhi Gynae Forum to show their, strength, not only North India Gynae Forum, but in the whole country.
Thank you, Dr. Meenakshi. And now I request Dr. Raj Bukaria ma'am. Raj Bukaria ma'am is the senior consultant at Fortis Lafam and Max Patpatganj. Ma'am is also the chairperson of the medical legal cell of the Delhi Gynae Forum. Ma'am has been doing so much, doing all these webinars, Kanun Ki Pathshala, which we all and grab so much of knowledge from ma'am. And ma'am, very gracefully, ma'am is doing these webinars every week, and we invite so much knowledge. Thank you so much, ma'am. And I just request you to give your pearls of wisdom for this webinar today.
At the outset, my heartfelt gratitude to Dr. Shada ma'am, Dr. Renu Mishra, and you, Shalini, and all the whole DGFS organizing team for providing me this platform with my mentor, Dr. Shada Jain. And I just already, it all has been told by ma'am and Dr. Meenakshi very well, explained why it is the need of examining and doing the film on the sexual survivor. But I just want to say only one thing. We as a gynecologist and obstetrician play a very vital role, and the value of our medical legal report by providing the examination, doing the complete evidence collection and the age determination, it is a very important legal evidence in the court of the law. And this will definitely further reduce the cases undergoing the sexual violence and increase the conviction rate. Also, it is very important when we'll see the film, which is so well documented and presented, and we, to every practicing doctor, whether it is a resident or whether they are the senior doctors, even in the private or the public sector, we are so ignorant about how to examine the rape victim or the sexual offense survivor. And if we do it stepwise and we follow the guideline, we will not miss out any single evidence collection, which will be helpful in giving justice to the woman health. And we all here are for the woman health. So that's all I want to say, and we can proceed for the film. Everyone is waiting to see the film, which is so important. Thank you.
Thank you so, yeah. Thank you so much, Raj ma'am. And now I invite the chairpersons for the first talk. My pleasure to invite Dr. Angela Aneja ma'am. Ma'am, are you there? Ma'am was
Yeah,
there.
yeah, I'm there,
Yeah,
very
yeah,
well
okay,
there.
yes, yes.
Just
And
one
Dr.
box away from you.
yeah, Angela Aneja ma'am is the Senior Director of
Maybe bus,
Obstetrics.
bus.
I
Thank you,
invite
Shalini,
Dr.
and
Yeah.
thank you, Dr. Renu Mishra, for having me over here. And honestly, from during my tenure, I always wanted to do this one of the session on
Yes,
the examination of the rape victim and prevention of STDs from them, but couldn't do it. Because we didn't know about the formulation and how to go about it. And I think Dr. Sangeeta Gupta, Dr. Sharda Jain ma'am, they have done a wonderful job, and now we have a video. So I think that this is the best time that we should all be aware, and we should even circulate this to other people also who are not joining it, because everybody should do it. So without wasting any time, let's call upon Dr.
Dr. Neena Bell is also there. Ma'am is also the director at Fortis Lafam. Welcome, Neena ma'am.
Thank you so much.
Yeah. Yeah. Yes, ma'am.
So
Go ahead.
let's start with the talk of Dr. Sangeeta Gupta, which is on the examination of survivor of sexual assault and rape.
Yeah, Dr. Sangeeta Gupta ma'am is the professor and the head at the ESI Basai Darapur. Ma'am is a great academician and she has many awards to her accolades. And more than that, she has been instrumental in making this video, which we all love it just to watch. And so we'll just hear her and she will just brief us and then we'll go through the video. Over to you, Sangeeta Gupta ma'am. Warm welcome.
Thank you, Shalini. Thank you, Delhi South Forum, for giving me this opportunity. And in fact, when in 2004, Madam asked me to do the job of making this film, I didn't realize its importance. I thought that I followed whatever Madam asked me to do. And I was knowing the long-term implications of this film, but now, after the Supreme Court judgment of in 31st October 2022, I am starting early because I want to give take the things at length. So then 2000. Just to wait. Yeah, with the Supreme Court judgment on 31st October 2022, the Supreme Court asked in a case judgment that all union and the state government have to ensure that guidelines formulated by MOHFW are circulated to all government and private hospitals. Conduct workshops for health providers. So today's whole process is a part of these type of workshops, that we have to conduct workshops for all health providers to communicate the appropriate procedure to be adopted while examining survivors of sexual assault and rape, and to review the curriculum of medical students and schools, that no two-finger test or per vaginum examination is done for assessing the sexual habit of a person. So, keeping these points in mind, the whole exercise has been formed. Now, what are these 2014 guidelines? After the Nirbhaya case, the government became very alert and they asked Justice Verma Committee to form guidelines so that a comprehensive care is to be given to the sexual assault survivors. Secondly, there was also a change in the definition of rape and sexual assault in the Criminal Law Act in 2013. And there was an introduction of POCSO Act in 2012. So all these things which happened in 2012 and 13, it made the government of India to form the guidelines with the aim of that all survivors of sexual violence have an immediate access to comprehensive responsible care that was not done in case of Nirbhaya, and when so much alertness was not there, and to highlight the medical and forensic responsibilities of health professionals. Now, once the guidelines were made, the protocol for medico-legal examination of survivor of sexual assault was finally made in December 2019 by LNGN Institute of Criminology and Forensic Science, Ministry of Home Affairs. And till date, we are following in Delhi state and NCR, all the governments, all the state governments have their own protocols to examine the sexual assault victim. But we in Delhi are following LNJN National Institute guidelines protocol for examination of sexually assaulted victim. And this protocol, copy of this protocol is available in each and every safe kit. So these are the guidelines and protocols served by the MOHFW in 2014. And this is the picture of a protocol book made by the LNGN Institute. Now, to start with, they should know what is a sexual assault. A sexual assault includes anything from touching another person's body in a sexual way to forced intercourse, means touching to forced intercourse without the person's consent is called a sexual assault. What is rape? So there is a change in definition of rape in 2013 as per CLA. A man is said to commit a rape if he penetrates his penis, inserts any object or a part of the body, or manipulates any part of the body of a woman to any extent into the vagina, mouth, urethra, or anus of a woman, or makes her to do so with him or any other person, or applies. So first part was the penetrative sexual act, and or applies his mouth means non-penetrative type of sexual assault. So both these definitions are now covered under rape, penetrative as well as non-penetrative. So applies his mouth to the vagina, anus, urethra of a woman under any of the following 7 circumstances: against her will, without her consent. Now, with her consent, when the consent has been obtained by putting her or any person to whom she is interested in fear of death or hurt, with her consent, when the man knows that he is not her husband, but he makes him to believe that lady that he is her husband. So this is again, even if consent is there, this is wrong. With her consent due to unsoundness of mind or intoxication, she is unable to understand what is going on with her and she consents. Then when unable to communicate the consent, and 7, with or without consent. This is POCSO, with or without her consent when she is under the age of 18 years. So very important line is when anyone is under the age of 18 years, maybe a girl or a boy or a married or a unmarried, this all is accounted as sexual assault. However, there are 2 exceptions. One is a medical procedure or intervention shall not constitute rape, means examination done by any medical person or any procedure done will not be a rape. And secondly, initially it was that a woman, a wife, if she is the age of 15 years, under 15 years, after 15 years, if there is a sexual act, then it was not rape. But there was an amendment in October 2017, under which the whole POCSO Act is applicable here. That is, even if the wife is under the age of 18 years, the sexual act is taken as sexual assault. Now, POCSO Act in a nutshell, what is a POCSO Act? It is the protection of children from sexual offences, and it was announced in 14th November 2012. That is Jawaharlal Nehru's birthday day. And as per the POCSO Act, a child is one who is aged below 18 years. So anyone who is aged below 18 years is a child, and POCSO is for the child. The Act defines different forms of sexual abuse, including penetrative and non-penetrative sexual assault, sexual harassment, and pornography. And any sexual assault is deemed to be aggravated when the abused child is mentally ill, or when the abuse is committed by a person in a position of trust or authority vis-a-vis the child, like a family member, police officer, teacher, or a doctor. A simple reading of POCSO Act suggests that any person can be prosecuted for engaging in a sexual act with a child, irrespective of whether any one of them consents to. The Act does not recognize consensual sexual acts among children or between a child and an adult. The POCSO Act would still apply where the offense is committed by a child. The only difference is that the procedure would be as per Juvenile Justice Act. Now, definitions, we have all, I have just said before that it is a penetrative sexual assault and non-penetrative sexual assault. It is sexual harassment and child pornography. Now, the most important point is, what are our obligations? What are the obligations of a health profession? Now, as per the Criminal Law Amendment Act 2013, both private and public health professionals are obligated to provide treatment to a sexually assault victim or survivor. As per section 164A of the Criminal Procedure Code, examination of a case of rape shall be conducted by a RMP without delay and a meticulous report to be prepared by the RMP. As per section 166B of Indian Penal Code, denial of treatment, as Madam Jain was saying, denial of treatment of rape survivor is punishable with imprisonment up to 1 year or fine or both. So, health professionals need to provide a comprehensive health care to a survivor of sexual assault. Now, let's come to the point, what is a comprehensive care? A comprehensive care means that initial resuscitation or first aid to the patient who comes to you as a sexual victim or survivor, informed consent for examination, evidence collection, police procedure and treatment, detailed history taking, medical examination, age estimation if asked or requested, and evidence collection as per protocol, documentation, packing, sealing and handing over the collected evidence to the police, treatment of injuries, testing prophylaxis for STIs, HIV, hepatitis B and pregnancy, psychological support and counseling, and referral for further help, that is for shelter homes or a legal support. Now, the most important point is that all the hospitals, may it be government hospitals or private hospitals, they should have a standard operating protocol in their hospital. And this protocol should be available in all the emergency areas. So there's no delay of time is, no wastage of time is there. And the need for this protocol is to provide comprehensive services, clarity of roles of each staff, to have uniform practice across all the doctors. The examination should be carried out in a complete privacy in a special room set up in the hospital for examination of a sexual violence survivor. The room should have adequate space, sufficient lighting, comfortable examination table, all the equipments required for a thorough examination, and the sexual assault forensic evidence kit for collecting and preserving physical evidence. Now, who can examine? Any registered medical practitioner can conduct the examination. In case of a female victim, every possible effort should be made to be examination done by a female doctor, but absence of availability of a lady doctor should not deny or delay the treatment and examination. Police personnel should not be allowed in the examination room. Now, one thing I would like to emphasize, that in POXO cases, if the child below the age of 18 years and if she is a female, we should try all things to get a female doctor examined in front of her, the child's guardian. But if even in that case, female doctor is not available, we can do the examination, however, properly documenting the cause that why a female doctor was not available. Now, if the survivor requests, her guardian, relatives, or the person with whom she feels comfortable may remain present while examination is being done. Now, how can any person can come to your clinic or in your hospital or in your casualty? She can come to you on her own only for treatment, with a police requisition after police complaint, with a court directive. The examining doctor is required to inform a police about the incident irrespective of consent for examination. I'll go into the detail later on. Medical examination cannot be conducted against her consent or without her consent. No court or person can force a medical examination. Minimum age of survivor for giving valid consent for medical examination is 12 years. In case of a child is below 12 years age, guardians / parents should be available, and if they are not available, consent can be obtained from a panel of senior doctors. Now, one thing is very important, that whenever patients and guardians are acting against the best interest of the child, especially in cases of incest, then a child welfare committee has to be informed. And consent has to be a detailed, informed consent, can be obtained by parents, panel of doctors, CWC or jurisdictional court. The consent should be signed by the survivor, a witness, and an examining doctor. Witness is any disinterested person. If survivor has to undergo MTP, then minimum age for valid consent is 18 years. For any surgical procedure, the age is 18 years. Consent should be sought in a language that the survivor understands. The doctor must inform regarding nature and purpose of examination. The procedure may involve an examination of the mouth, breast, vagina, anus, or rectum. Examination may include removing and isolating clothes and samples such as scalp hair, genital swab, nail clippings, or blood, etc. Proper documentation has to be done. Very important is that if they refuse for the examination, refusal of consent has to be there. Then comes the examination. Now, whatever now I am discussing is shown in detail in the film. So I will go through very fast in this. So we have to have the evidence of sexual violence, whether the sexual act has been completed or it has been just a start or penetrated. Evidence to a certain mental incapacity, evidence for medical age determination, and evidence to identify assailants through medical. This is very important. Whatever samples we are collecting, these samples are for the DNA estimation of the accused. So they can be in the form of hair, semen, blood, nails, clippings, etc. Then there has to be a general physical examination, examination for injuries, local examination. Now, age estimation is not necessary if we are sure that what is the age, but can be done or has to be done when the police requisition is there. Evidence collection does not prove, is not 100% proof that there is the sexual assault has occurred or not occurred. Absence of medical evidence does not rule out the possibility of rape or sexual assault. So again, we have to collect it with the safe kit, which we are going to see in detail. Medical samples are collected and forensic evidence samples are collected. Medical samples are to be sent to the local hospital lab, and forensic evidence collection has to be sent to the forensic lab. And for medical samples, blood, for HIV, VDRL, HBsAg, blood grouping, and urine test for pregnancy, ultrasound for pregnancy. And if we suspect any internal injury, then also we can get the ultrasound done, or we need to do the X-ray if there is any obvious injury. Informed consent has to be taken, history of nature of sexual assault has to be taken, examination findings to be written. Most important point in sample collection is time lapse between incident of sexual violence and the time of examination. Post-assault activities also make a lot of difference in sample collection, because bathing, douching, washing, urination, defecation, all this change the evidence absence, or they make the presence or absence of the samples. Now, as this, I will say that our NICFS, the protocol says that spermatozoa may be recovered from cervix and posterior fornix for a longer period of time than in vagina after the assault. Hence, we can collect the samples up to at least 3 weeks after the assault, as per the latest researches. So, these all will be discussed in detail, that how to take the samples of, how to take the swabs, how to take the sample for semen, spermatozoa, and all that we are going to see in the film. And lately they have said that blood collection card is a use of a blood collection card for DNA testing and sampling is a must, as any sort of DNA collection, DNA sampling is must as per 164A of CRPC. Evidence material should be collected in pre-labeled envelopes. The swab taken, this again is very important point, that swab takers must first be air dried before putting them into the tube and then into the envelope. Otherwise, they get rotten. Even if a woman is menstruating, we can collect the samples and we can ask the woman to come again once the bleeding stops. And after the examination, the survivor is permitted to wash up and change the clothing made from the hospital. We have to dry the sample, pack, seal, and hand it over to a police in a very chained method. There should be a proper chain of handing. Products, now if there is a MTP we have done in a case, then products of conception are collected for doing the DNA profiling and to ascertain whether they match with the that of the accused. These have to be sent to the DNA lab immediately. If this is not possible, then the products of conception should be stored in a container maintaining the cold chain or cold storage at 4 degrees centigrade. Again, the packaging and forwarding is of the evidence is very important. Now comes what is the role of provisional clinical opinion. Once we do the examination and whether we found or we do not find any evidence, we have to give a provisional clinical opinion, and automatically police also asks you to give a provisional opinion. But the provisional opinion, we cannot give anything in detail. We can just give our examination findings, and we can say that rest of the opinion will be given on the availability of this evidence which we have collected or the lab reports. So in a nutshell, what we have to see whether there is a genital or physical injuries are present, because if both the injuries are present, they are suggestive forceful penetration, or only genital injuries are present, or only physical injuries are present, or neither genital or nor physical injuries. So in the provisional opinion, we can only say that these are the injuries present, and we have collected these number of samples, and the final opinion can only be given later. Opinion about the age, if it is required, and then final opinion after lab reports, we can give that based on these lab report results of the lab reports, we can say that whatever we feel that the sexual assault, fresh sexual assault occurred or not occurred, but we cannot say that rape has been there or not. That in one slide I will tell you later. So we can give the final opinion, and before going as a witness to the court, we should have all the documents, all the opinion and all the lab results with us so that we can prove our point there. But there are still limitations that normal examination findings neither refute nor confirm the forceful sexual intercourse. Absence of injuries may be due to inability of survivor to offer resistance to the assailant because of intoxication or threats. Negative lab results may be due to delay in reporting for examination activities such as urinating, washing, and so on. And the reasoning must be mentioned while formulating opinion. We should always write this may not be there, this may be there because of all these limitations. So then there are treatment comprehensive. I am talking step by step of all the points of comprehensive care. So now comes the treatment guidelines: pregnancy prophylaxis, emergency contraception, then all the treatment, whatever we are suspecting. If we have to give prevention for HIV, we have to give treatment for STD. That all will be shown in the film in detail. And then follow-up visit is very important. We can call her for re-examination after 2 days. Thereafter, at 3 and 6 weeks, we can have a repeat HIV test for her. We can have a repeat pregnancy test for her, and all the follow-up methods will help the person to take the things into the court. Access to physiological sequel and reiterate need for psychological report is very important. And if patient comes only with pregnancy after sexual assault, then when we can offer her MTP. The products of conception may be sent to evidence of forensic lab. So they must be sent to the forensic lab. So now the points to remember. This I want to highlight. Rape is a crime and not a medical condition. Rape is a legal term and not a diagnosis to be made by the medical officer treating the victim. The only statement that can be made by the medical officer is that there is evidence of recent sexual activity or there is no evidence. Whether rape has occurred or not is a legal conclusion, not a medical one. That is the reason why even the opinion of the doctor that there was no evidence of sexual intercourse or rape is at times held to be not sufficient to disbelieve the accusation of the rape by the victim. Consent of the survivor must be taken before examination. If the survivor is less than 12 weeks, obtain the consent of parents or guardian. Police has to be informed in all the POXO cases and in all the cases where patient has come to you as a sexual assault. May she refuses for examination. वो कहती है मुझे examination नहीं कराना. but आपको उसका MLC तो बनाना ही बनाना है once she reports to you for any treatment. Per vaginal, per speculum examination should not be done until unless we want to collect the samples or we want to see for the injuries. And previous sexual experience or habituation to anal or vaginal intercourse should not be examined or documented because there is no relevance of this. Two-finger test for hymen intact or this thing should not be done, neither conducted or not commented upon. Age estimation is important part, but if asked, otherwise, if we are sure there is no need to do for the age examination, medico-legal examination report should be made in triplicate, one for investigation officer, second for the survivor, and third for the hospital record. Opinion drafting should be done immediately after the examination of survivor. The main of standard protocol is to collect evidentiary materials without missing any step during medico-legal examination of the survivors of the sexual assault. The efficacy of sample collection depends upon the history of nature of assault, time elapsed between the assault and the examination, and also on post-assault activities. Therefore, date and time of examination and collection of all the samples must be clearly mentioned on the reports. So, thank you. And now again, everything will be repeated in the film. Thank you.
Yeah, thank you so much, Sangeeta ma'am. That was such a comprehensive and yet elaborate, and it was very nice. Where you cleared many doubts of ours. And do we take any questions, or do we straight away
I should go with the film?
Question.
Okay.
Can I ask one question, Dr. Sangeeta?
Yes.
So, on one of the slides, it said the witness can be or should be a disinterested person. What does that mean?
That means that person who is not, जैसे आपका उसका family member आया है साथ में, तो उस family member को आप witness नहीं बना सकते.
So somebody who's not related.
They're not related or not concerned by with that particular, कोई भी मोहल्ले का भी बचाना आ जाएगा, उसका भी interest है, तो it should be totally disinterested person.
Okay.
So then, can anyone from the hospital, like maybe the staff or can they act as?
Preferably, it should be a patient relative. Usually, any other patient's relatives who are around or anything in POCSO. Of course, if you don't want to reveal the identity, you can take a hospital staff.
Okay.
And
Till now,
anything, Dr.
let's have a
Angela, Dr.
See, basically,
Neena,
I have had a patient when I was in Max. There was this
Film
lady
देख लो,
who
madam,
came to
पहले
me.
film देख लो.
Okay.
हाँ,
We'll
So I
continue the
just-
discussion
yeah.
after that.
Perfect.
Yeah.
Perfect.
Sahiti, can you play the video?
Yes, ma'am.
Yeah, start the video and then we'll take the questions.
Just a second, ma'am.
Yeah, sure.
The clock never stops ticking, nor do the rapes.
Can you hear, ma'am?
Yes. The video is clear.
This is a true illustration. A girl was brought from a village to a city for domestic work. She was sold to a brothel. She was recovered during a raid on the brothel. On medical examination, it was found that she had been physically tortured and her genitalia had been dilated with tampons to adjust to disproportionate male organ. She also showed old healed hymen and tears in the vaginal wall. She was tested positive for gonorrhea and semen traces were also recovered from stains. An age determination test corroborated she was just 12 years.
A young girl is imported for commercial sexual exploitation. It is the beginning of repeated sexual assaults on the adolescent. The number of sexual assaults on her rise with every passing hour. Social scientists make 4 points. The statistics reported by the Crime Bureau are just the tip of the iceberg. Owing to guilt, shame, cultural compulsions, and poor knowledge of law, very few cases of sexual abuse are disclosed and reported in our country. It is a fact that both rape and sexual trafficking cases are on the rise. In our land, conviction rate of rapists and sexual criminals is very low. Varying from state to state, only 20 to 30% of the accused get convicted and punished. There is a relationship between conviction rate and sexual crimes. Higher conviction rate can help in the prevention of sexual crimes and trafficking. Doctors are the most crucial link in raising the conviction rate. In all the sexual abuse cases in the court of law, the evidence collected by the doctors through medical examination of the rape victim, the age determination test, and the medico-legal report play a key role in deciding whether the offender will get convicted or not.
All of us are clear that to prevent rape and immoral sexual trafficking, the conviction rate must be raised. In our country today, the right legislation is in place. What is needed is medical evidence that goes in favor of the victim in the court of law. As the nodal agency for controlling trafficking, Indian Medical Association is committed to raise the conviction rate and to get justice to the rape victims. Indian Medical Association's approach is bilateral. It is seeking the government support to establish rape crisis centers in the entire country. At the same time, it has taken up steps to equip the medical officers with the skills required for providing accurate medical evidence. This film is a part of that process. Through this film, my colleagues here, Dr. Sunita Fotedar, Senior Specialist Department of Gynae, Swami Dayanand Hospital, Shahadra, Dr. Sangeeta Gupta, Head of the Department of Gynae, ESI Hospital, Basai Darapur, and Dr. Gaurav Agarwal, the former Assistant Professor, Vardhaman Mahavir Medical College and Safdarjung Hospital, will take you through the entire process of medical examination through a standard protocol to be followed throughout the country. The original film was made on the request of Ministry of Women and Child Development in 2006, with the aim of imparting knowledge about standardized and uniform medico-legal examination of survivor of sexual assault. And now it is revised in 2023 by Delhi Gynecologist Forum and North India Gynecologist Forum based on Government of India guidelines of 2014 after Nirbhaya's case. We also incorporated POCSO Act of 2012 for medical fraternities' knowledge and compliance. The Honorable Supreme Court of India is serious and taken a landmark decision on 31st October 22. Supreme Court directed the Union government as well as the state governments to ensure that the guidelines formulated by Ministry of Health and Family Welfare to be circulated to all government and private hospitals. Conduct workshops for health providers to communicate the appropriate procedure to be adopted while examining the survivors of sexual assault and rape. Review the curriculum in medical schools with a view to ensure that the two-finger test or per vaginal examination is not prescribed as one of the procedures to be adopted while examining survivors of sexual assault and rape. Guidelines and protocols on medico-legal care for survivors, victims of sexual violence. Based on the guidelines of Ministry of Health and Family Welfare 2014. The guidelines are essentially aimed at doctors who might one day be called upon handle the survivor of sexual assault in the course of their duty, whether in government hospital or private. Sexual assault victim cannot be denied treatment in either of these hospitals when they approach them, as denial has lately been made a cognizable criminal offense punishable with appropriate jail terms or fines or both. Apart from attending or treating, doctor's responsibility and duty is in recording and documenting the medical aspects in order that such cases, when they come before the criminal justice system, are not found wanting in the quality of evidence produced by the prosecution during trial, leading otherwise to poor conviction in rape cases. There are legal obligations of health professionals. As per section 164A of Criminal Procedure Code, examination of a case of a rape shall be conducted by registered medical practitioner without delay and a meticulous report to be prepared by the RMP. The health professional need to respond comprehensively to the need of survivors. Comprehensive response care means initial resuscitation and first aid, informed consent, detailed history taking, medical examination, age estimation if requested by the investigating agency, evidence collection as per the protocol of Government of India 2014. Documentation, packing, sealing, and handling over the collection evidence to police, treatment of injuries, testing, prophylaxis for STIs, HIV, hepatitis B, and pregnancy, psychological support and counseling, referral for further help to shelter home or for legal support. This particular chart gives you overview of this comprehensive response care. Operation guidelines. Every hospital, clinic must have a standard operating procedure for management of sexual violence to provide comprehensive services for the smooth handling of cases and clarity of roles of each staff, to have uniform practices across all doctors in the hospital. The POCSO Act has come into force with effect from November 2012, along with the rules framed. It is a comprehensive law to provide protection to the children from the offense of sexual assault, sexual harassment, and pornography, to safeguard the interest of the child at every stage of judicial process for the proper development of child in view of his or her protection of the right to privacy and confidentiality. The most important provision of the Act is that it gives a definition of the child. It defines different forms of sexual abuse, including penetrative and non-penetrative assault, and what constitutes aggravated sexual assault. The prescribed punishment, the mandatory reporting of the crime. It is also important that abatement of offense under the Act would also attract the punishment as that of the offense committed. Examination of the child shall be conducted even before a FIR or a complaint is registered by a government doctor in a government hospital or a hospital run by local authority, with the consent of the child or of a person competent to give consent on the behalf of the child. The examination must be done within 24 hours from the time of receiving information about the offense. Anesthesia can be administered only in those cases to enable medical examination which are done in the best interest of survivor and are not possible otherwise. The doctor shall forward the report to the investigating officer without any delay, who shall forward it to the magistrate. As far as consent is concerned, in the POCSO Act, a child is one who is aged below 18 years. Minimum age of survivor for giving valid consent for medical examination is 12 years as per provision of section 89 and 90 of IPC. In case of child below 12 years of age, whenever parents and or guardians are not available for giving consent for examination, then informed consent can be obtained from a panel of senior doctors in an administrative position in the hospital who will act in the best interest of the child. When doctor suspects that the child has been or is being sexually abused, even in the absence of consent of a child or a parent, have mandatory legal obligation to report child sexual assault cases to the appropriate authorities. If he fails to do so, he may be liable for punishment of imprisonment of up to 6 months with or without fine. Standard protocol for medical legal examination of survivor or sexual assault is prepared by National Institute of Criminology and Forensic Medicine, Ministry of Home Affairs, Government of India. The main aim of standard protocol is to collect evidentiary material without missing any step during medical legal examination of survivors of sexual assault. Now, points to remember. Incident of rape occurred or not is a legal issue and not a medical diagnosis. Hence, on the basis of medical examination, doctors should not conclude whether rape has occurred or not. Another point on spermatozoa. Spermatozoa may be recovered from cervix and posterior fornix for a longer period of time than in vagina after the assault. Hence, it is advisable to collect swabs up to at least 3 weeks after the assault, as per merit of the case and whether possible considering the age of survivor. This table clearly presents that the motile sperms can be seen up to 7 to 8 days, while nilmotile sperms can be seen in vagina up to 10 days and in the cervix up to 19 days. Informed consent. The consent of the survivor must be taken before examination. If the survivor is less than 12 years, obtain the consent of parent or guardian. A doctor must inform the survivor, parent or guardian regarding the nature and the purpose of examination. That the examination will help in prosecution of those who committed the crime. That the procedure may involve an examination of the mouth, breasts, vagina, anus, and rectum. That the examination may include removing and isolating clothing and samples such as scalp hair, genital swabs, nails clipping, blood, etc. That the survivor or the parent or guardian, any other person in whom the child reposes trust, has a legal right to refuse full or part of the examination. That refusal of consent would not affect her treatment aspect of the survivor, but may hinder the conviction of accused. Informed refusal must be recorded with the signature of the survivor and witness. Information to police. As per law, the examining doctor is required to inform the police about the incident, irrespective of the consent for examination. Point to remember, as far as per vaginum and per speculum examination is concerned, should not be done unless required for detection of injuries or for medical treatment. No comment should be made on shape, size, and elasticity of the anal and vaginal opening or about previous sexual experience or habituation to anal or vaginal intercourse. Two-finger test, neither to be conducted nor commented upon. Injury documentation must be done in all cases. Toluidine blue dye, alternate light source, wood lamp, colposcope may be used wherever required to highlight injuries, bite marks invisible to the naked eye. Depict the injuries on appropriately body diagrams and record with details the size, site, shape, color, etc. Absence of injuries may be due to inability of the survivor to offer resistance to the assailant because of intoxication, threats, and unconsciousness. Age estimation is an important part of the survivor examination, if relevant or asked by the police or court. Medical legal examination report has to be made in triplicate. The original has to be given to the police, the second copy for survivor, and the third for the hospital record. Forensic evidence collection. Strive to collect as much evidence as possible from survivor, guided by scope of informed consent, history given regarding sexual assault, and examination findings. Forensic evidence collection, packaging, and forwarding of evidence material for forensic analysis. Based upon the history of the case, evidence materials should be collected in pre-labeled envelope contained in the evidence collection kit. The swabs must be thoroughly dried before putting it into envelopes. The clothing, if wet or having body fluid stained, should be thoroughly air washed before packing. Reference blood sample of the survivor should preferably be collected on blood collection card for DNA testing as well. For this, wipe the tip of the ring or middle finger with betadine swab, prick it with sterile lancet, and allow a few drops of the blood to fall within the circle of the card. Dry it before packing. This is the forensic evidence collection kit called SAFE kit. Collection of samples for hospital lab are blood for HIV, VDRL, and hepatitis B, urine tests for pregnancy, ultrasound for pregnancy, internal injury, X-ray for injury. If no evidence material is collected in any envelope of the kit, the envelope should be crossed and no sample collected should be written on it. The evidence collection kit should be sealed with tamper-proof seal. Medical sample should be sent to hospital lab and forensic samples should be packed in evidence collection kit. Provisional opinion drafting should be done immediately after examination of survivor on the basis of case particulars and findings of detailed clinical examination. Final opinion to be formulated after receiving the reports of the forensic lab. It should be always kept in mind that a normal examination findings neither refute nor confirm the forceful sexual intercourse. Hence, circumstantial and other evidence may be taken into consideration. The types of evidence to be collected will depend on the actual time of medical examination. Post-sexual violence, keeping in mind that there could be delays in reaching the healthcare facility for medical examination due to various social issues and barriers. Hope this film inspires you to do perfect medico-legal examination.
Elimination of sexual abuse and trafficking of women and children for sexual exploitation is a key priority area for the Department of Women and Child Development. The department is studying the problem in greater depth and collating data. It is building awareness in civil society and NGOs. It is advocating national legislation at par with international and regional instruments for eliminating trafficking. The film will now instruct you on how to conduct a state-of-the-art examination of a young female sexual assault victim, medical forensic examination with in-depth explanation, age determination. Summary of forensic examination. The film has the following learning objectives: to introduce a standard kit with all the tools required for medical examination, to learn proper method of conducting the forensic history and physical examination, to learn proper evidence collection techniques, to learn the right procedures of age determination, to learn the prophylactic regimens to prevent disease and unwanted pregnancy, to know where to access technical information on forensic medical examination. This here is a standardized kit being demonstrated. In some cases, you may not need to use all the envelopes of the kit. For example, if no debris is found on the body surface, the packet of debris will not be used, and no specimen will be written across the label. In other situations, you may need extra supplies in the form of needles and oral swabs from the hospital stores. For successful forensic examination, you must do the following. Pay a thorough and close attention to details. Wear gloves at all times. Touching the victim, the kit, or its contents with bare hands may leave your DNA in the evidence. Wear powderless gloves if possible, since the powder may interfere with the laboratory examination. Moisten the speculum with warm water, not with lubricating jelly, as the jelly may interfere with forensic tests. Before the examining physician comes, let a trained nurse calm and reassure the young victim. Building rapport with the victim is crucial. Otherwise, the victim will be hesitant to talk, making her own case weak. Let her explain to the victim gently what the medical examination is all about and its importance for the trial. Remove her fears about the process she is going to go through. This is a very important and critical step. Let the paramedic staff give the victim undivided attention for a few minutes. The step 1 is to get the legal consent form signed. The doctor must take the legal consent before she begins the evaluation. Please explain to the victim what the consent is for, why the girl must sign it, and how it is going to help her get justice. Consent must be taken in the victim's native language.
Legal consent is a must in every type of medical legal case, be it a police referral, be it a direct request of the victim or her guardian for a medical examination, be it a rape case or a case of sexual trafficking for commercial sexual abuse.
It's important that the physicians and the paramedic staff's attitude be non-judgmental. It is a commonly held prejudice in our culture that the girls who get raped are the loose and bad sorts of girls who invite it. Inquire within and make sure that this is not the attitude you or your staff holds. Such an attitude, if harbored and communicated, will create negative feelings and the victim will become uncooperative. Make sure that the examination meant to help the abused child doesn't itself become a source of distress for her. Second, as a physician, it is not your responsibility to determine whether a rape took place or not. Your responsibility is only to carefully examine the victim, collect the evidence, and document the findings. Never comment whether a rape has taken place or not. Rape is a legal term, and only a court of law can comment upon it.
बेटा मैं तुमसे कुछ सवाल पूछूंगी. पहले ये बताओ, ये हादसा कब हुआ?
Now the next step is to start filling the examining physician's report. The first page is a detailed history form. It is not all-inclusive, but covers most of the questions which need to be asked about the victim. Be aware that some victims may not understand medical terms. It is sometimes necessary to describe body parts or specific sexual behavior.
तो ये हादसा तुम्हारे साथ कल रात 10 बजे हुआ. अब मुझे जरा सोच के बताओ कि उसने तुम्हारे साथ संभोग किया? मतलब अपना अंग तुम्हारे अंदर डाला?
Occasionally, it may be necessary to use more explicit or even slang terms to ensure the victim clearly understands the question.
उसने स्खलन भी किया? समझते हो इसका मतलब? पानी अंदर छोड़ना, उसने पानी छोड़ा?
Ejaculation may occur within the vagina during the assault. However, semen may be deposited on the victim's skin or clothing. Proper examination of all the three is necessary to not miss the evidence.
क्या तुमने उसके बाद कपड़े बदले? नहीं बदले. उसके बाद तुम नहाई हो? नहीं नहाई.
A common misconception is that douching or bathing eliminates the ability to collect evidence. Actually, seminal fluid will often be recovered from the vaginal and cervical mucus, even if douching or bathing has occurred.
ठीक है, अब तुम ये कपड़े उतारोगी, क्योंकि ये कपड़े आगे जांच के लिए जाएंगे. सुरजीत, तुम इनके कपड़े उतारने में मदद करोगी और ये सारे कपड़े हैं, संभाल के रखोगी और इसको एक गाउन दो पहनने के लिए. ले जाओ तुम इन्हें.
The victim's clothes must be carefully collected and placed in the evidence bag labeled Step 3, Outer Clothing. The underclothing is kept separate from the outer clothing to prevent contamination. Prior to the execution, prepare the slides that will be required to be used in step 9. This will save time when the speculum is in the vagina. Finally, prior to beginning the examination, the appropriate size speculum should be chosen. Most of the times, a medium-sized Cusco speculum will be appropriate because of its narrow and flat blades. Now we resume the physical examination, that is step 4. Usually, we don't find multiple types of debris or stains. However, if more than one type of evidence is found, you must use a separate packet for each. Debris found in the pores of the skin is often an important link to the crime scene and the assailant. The entire body surface should be examined from head to toe for fibers, leaf matters, and so on. Remember, it is imperative to place debris from each different site in a separate packet and mark accordingly. All the envelopes in the kit are self-sealing. Never moisten them with saliva. If a struggle took place, the outer layer of the skin of the assailant may be trapped under the victim's fingernails. It may be used for DNA analysis. Debris should be placed in white folded paper and then placed in packets marked step 4. A collection stick is enclosed within the packet. Use it to perform the fingernail scraping. The scraping should be done very gently as to remove loose debris only and not the victim's nail bed tissue, which is rich in the victim's DNA. Do this over the paper. Drop the collection stick in also. Refold the paper. Place items in the envelope and mark accordingly. Any suspicious stains should be lifted by placing a drop of distilled water on the stain and rolling the collection swab across the stain. The swab is then placed in the tube. Remember, each item of evidence collected in step 4 must go into a separate envelope. Accordingly, the kit has more than one packet. If the system provides for it, ask for a photographer and take the photographs recording the injuries. If any are found, describe the injury or injuries on the physician's examination form.
सविता, एक सवाल का जवाब दो मेरा। उस आदमी ने तुम्हारी छाती को मुंह लगाया था। मैं तुम्हारी एक छाती से जांच लूंगी, कोई परेशानी की बात नहीं।
If the assailant's mouth contacted the victim's breast, place a drop of distilled water on the nipple area and swab with the collection swab. If the assailant is a secretor, which means he secretes evidence of his blood type into the saliva, semen, and other body fluids, it is possible to determine his blood type and possibly DNA fingerprinting by collecting dried saliva from the breast. Remember, the envelopes are self-sealing and should not be moistened or licked by the physician. It is now time to begin pelvic examination. Please remember, if the victim is a minor and resists examination, or if she is bleeding profusely, the medical examination must be conducted under anesthesia. This instruction is not to be ignored under any circumstances.
ये कंघी देखती हो? इस कंघी से मैं
The
सबसे पहले
first
तुम्हारे
step
बालों में
is
से
to
जांच
comb through the pubic hair with a plastic comb. Place the collection paper under the victim's butts and gently comb through the victim's pubic hair. loose or foreign hair will drop onto the paper. The comb is then placed on the paper. The paper is folded and put in the envelope.
अब मैं तुम्हारे बाल थोड़े से
Clip
काट के
several hair close to
आगे
the skin
जांच के लिए भेजूंगी।
and place the
बिल्कुल
sample
परेशान
on
ना
the collection paper.
चिंता की कोई बात नहीं है, just relax।
Pubic hair, which appears to be matted or stuck together, may contain seminal fluid. This area should be clipped close to the skin and submitted in the packet for matted pubic hair. Now, carefully examine the vulva for signs of trauma. Red discoloration representing bruising, tears of the posterior fossa, and bleeding from the hymen are examples of the kind of findings you may come across. The kit contains slides that can be closed shut. One is marked C for cervical and the other V for vaginal. Cotton swab appears to be the most effective vehicle because they provide the highest DNA material for analysis by common methods. The swabs are contained in their respective tubes labeled C for cervical and V for vaginal. The vagina is carefully inspected, and using the vaginal swab, a sample of the fluid from the posterior fornix is collected. The swab is then used to make a wet smear. Prepare the wet craft by rolling the swab across the slide. Seal the swab by placing it in the tube or box labeled vaginal swab. Retrieve the swab from the tube labeled cervix and collect fluid and mucus from the cervix. This swab too is used to make preparation as with the vaginal fluid. Since the cervical mucus may be thick and difficult to get onto the slide, the cover slip is sometimes used to ease the mucus onto the slide. The swab is then placed in the tube labeled cervix. Washing of the vagina is then performed using the preloaded syringe and catheter. The fluid should be injected into the upper vagina and then agitated slightly with the speculum. Draw the fluid back into the syringe and then place it in the red top tube provided. This will also be examined in the forensic laboratory for the presence of spermatozoa, protein markers, and DNA. The anus tool used for the examination consists of two parts, a hollow sheet to allow visualization and an obturator to allow safe and easy insertion. It helps to perform the anoscopic examination using lubricating jelly, which is water-soluble. The obturator and sheet should be slowly inserted into the anus and used for carefully visualizing a close-up for tears and contusions. Replace the obturator prior to rotating the anoscope. Inspect all four quadrants and, after careful examination, collect the fluid samples with the swab and prepare mount slide. Perform the culture if the victim was forced to perform oral intercourse. Inspect the oral cavity and collect the appropriate swabs and cultures. The areas most likely to yield spermatozoa are the vocal gingival pockets just above the second molar or the interdental spaces. Take care not to induce bleeding during collection. Step 14 constitutes of collection and analysis of the victim's blood. Analysis will be performed at the hospital's laboratory. This is done to ascertain the victim's blood type. It is also done as a service to the victim because the blood is screened for HIV, hepatitis B, and also for syphilis, an additional red top blood tube, and a urine specimen should be collected if toxicology studies are required. This should be done if there is suspicion of drug or alcohol intoxication. The examination of the victim is now completed. The evidence kit is sealed with a tamper prevention tape contained in the kit and is placed in the bag labeled biohazard. Place the bag in a locked refrigerator or under lock and key in a secure area till the time it is delivered to the police authorities. Once you have examined the patient, therapeutic aspect is important for prevention of pregnancy and STDs, including HIV and hepatitis B.
सविता, मैं तुम्हें एक बात और बताना चाहूँगी। ऐसे हादसे के कारण दो तरह की परेशानी हो सकती है। एक तो प्रेगनेंसी हो सकती है, एक संक्रमित रोग हो सकते हैं। हम इन दोनों के लिए तुम्हें दवा दे सकते हैं। क्या तुम ऐसी दवा लेना चाहोगी? ले लोगी दवा? ठीक है।
Data concerning the incidence of STDs following a sexual assault are few. However, it is estimated that gonorrhea is contracted in 1 in 30 cases, chlamydia in 1 in 10, condyloma in 1 in 4, HIV in 1 in 1,000, and syphilis 1 per 1,000. The incidence for transmission of hepatitis B is largely unknown. However, in non-immune or unvaccinated individuals, immune globulins should be considered. Suggested protocol and dosages against these potential infections are shown here. In non-pregnant, non-allergic individuals, one of the most common and accepted regimens for prophylaxis against both gonorrhea and chlamydia is doxycycline, 300 milligrams orally stat, followed by 100 milligrams twice daily for 3 days. Fluoxetine is also an acceptable alternative at a dose of 400 milligrams twice daily. A little tolerated but more expensive alternative is azithromycin in a one-time dose of 2 grams orally. In pregnant and adolescent, erythromycin is an alternative at a dose of 1.5 grams orally stat, followed by 500 milligrams 4 times daily for 7 days. The risk of HIV infection is small. However, should prophylaxis be indicated, the correct regimen usually consists of triple drug therapy with zidovudine, lamivudine, and nevirapine, or stavudine, lamivudine, and nevirapine. This is now available in the country. The incidence of pregnancy in susceptible victims is estimated as nearly 8 for 100. Prophylaxis against pregnancy may be effective up to 72 hours. Using dedicated levonorgestrel emergency contraceptive pill, the pregnancy rate is brought down to 1 per 100. By using conventional oral contraceptive pills, it is brought down to 2 per 100. In order to enhance evidence collection, it may be necessary to employ one or more special forensic techniques: colposcopy to search for microlacerations, toluidine blue staining to enhance the texture of microtrauma, Wood's lamp examination to enhance the texture of stain or the skin, especially seminal fluid stains, forensic odontology for bite mark casting. Colposcopy is the examination of the lower genital tract using a binocular microscope. By bringing the skin of the vulva under magnification, it is possible to find microlacerations, which will otherwise be undetected. If the victim reports that she has had no sexual activity for several days prior to the assault, and especially if the victim is virginal, microlacerations are a significant finding. Toluidine blue is a stain which assists in identifying small lacerations. The stain is applied with a cotton tip applicator or sprayed on the vulva. The excess is washed away with water. The stain is taken up by the subcutaneous connective tissue exposed if lacerations occur. Thus, these lacerations show up as short lines with staining. A Wood's lamp is a very useful tool in detecting stains, especially semen, which is not easily visible to the naked eye. To use it, darken the room and project the UV-colored light across the skin while looking for areas which shine or fluoresce. The Wood's lamp illuminates the surface beneath the skin. The areas which show white or proluminescence are then sampled with moistened swab for later examination in the laboratory. Additional special techniques include forensic odontology, in which bite marks are photographed and 3D casts are made, which may be matched to the jaw pattern of the assailant. The findings of these special forensic examinations should be recorded on the physician's examination report. Now we move on to the age determination.
Age verification of trafficking and sexual abuse victims is mandatory under Section 15, subsection 15A of the Immoral Trafficking Prevention Act of 1956. Age verification establishes whether the victim is a major or a minor, and this has a critical bearing on the outcome of the case. According to the ITPA, trafficking of minors is a more heinous offense, and it warrants much more stringent punishment. Age determination constitutes of 4 parts: general physical examination, examination of secondary sexual characteristics, dentition, and radiological examination. Conduct a general physical examination and secondary sexual characters examination using the age-related data for height and weight for boys and girls separately, and examine the development of secondary sexual characteristics like hormonal changes, axillary hair, acne, menstruation, breast development, the pubic hair, in line with Tanner's indicators of puberty. Dental X-rays like orthopentogram or an OPG will establish the age fairly accurately between the ages of 6 and 12 years. Similarly, radiological examination of bones will give a fairly accurate age estimate by studying the ossification centers of long bones. A thorough dental and radiological examination can give correct age estimation within plus minus 6 months. The age determination test should be conducted for all trafficked victims referred to a medical officer for a medical report, whether or not the investigative agency has specifically requested for it or not. Never rely on a single method for age determination. A combination of methods just discussed should be used. The medical legal report should be submitted to the investigative officer within 48 to 72 hours of conducting the examination.
Standard protocol for medico-legal examination of survivors has been revised by Lok Nayak Jayaprakash Narayan Institute of Criminology and Forensic Sciences, Ministry of Home Affairs, Government of India in 2019. I am happy to share that I was part of this process. These are based on guidelines issued by Ministry of Health and Family Welfare, Government of India in 2014 regarding the same. The aim of revision of standard protocol is to collect quality evidence material step by step without missing anything during medico-legal examination of survivors of sexual assault. The Sexual Assault Evidence Collection Kit has a booklet incorporated in it for reporting and documentation in the prescribed format in triplicate, which are color-coded and self-inking copies. The first copy is to be handed over to the police investigating officer. The second copy is given to the survivor, and third is kept for the hospital records. The booklet has standardized format for taking consents for medical examination, for treatment, medico-legal examination, and sample collection for clinical and forensic examination. The format has prescribed medical interview for history, examination, and sample collection in the new kit. The kit has options to document medical opinion also in the prescribed formats. The standard SAFE toolkit has numbered, titled envelopes in it, which are there for stepwise evidence collection by healthcare professionals. It has also incorporated all important logistics, including DNA card, etc. History-based sample collection is done sequentially. Envelopes are sealed after putting the sample inside. The envelopes which are not used are marked "No sample collected." All samples containing envelopes are then put in the box, and the box is sealed, signed, and stamped by the medical officer. The chain of custody is also mentioned on the cover and signed by all involved.
We now provide you with a brief summary of all the steps involved in conducting a thorough medical examination. Step 1. Obtain victim's consent. Step 2. Obtain the victim's history and record all the information on the physician's examination sheets. Step 3. Obtain the victim's underclothing and place them in the appropriate bag and label. Step 4. Perform complete body surface examination and collect any foreign material. Perform fingernail scrapings if indicated. Request photographs if indicated. Sketch findings on the examination sheet. Step 5. Collect secreted test swab from victim's breast if oral contact occurred. Step 6, 7, 8. Collect, comb, clip matted hair samples with the enclosed scissors. Step 9. And collect slides and swabs. Step 10. Collect cultures. Step 11. Collect washings of the vagina. Step 12, 13. Perform oral and anal examinations as indicated by the victim's history and collect wet slides, swabs, and cultures. Step 14. Collect samples of the victim's blood for forensic and clinical testing. Perform additional forensic techniques as indicated, such as colposcopy, toluidine blue staining, Wood's lamp examination, bite mark impressions, bag, label, and sign the evidence envelopes and place them in the kit. Seal the kit with tamper prevention tape to be forwarded to the forensic lab. Dispense prophylactic medications if indicated and desired.
My colleagues, Dr. Sangeeta Gupta, Vice President of Delhi Gynecologist Forum and Vice Chairman of North India Gynecologist Forum, Dr. Anita Rajoria, the Chairperson of Public Awareness Committee of North India Gynecologist Forum, Professor Gaurav Agarwal, the medical legal consultant and a lawyer, have just presented to you the standardized methodology of medical examination, forensic evidence collection, and age determination of sexually abused survivor. Let's recapitulate. The premise we started with, first, that the conviction rate must be raised to prevent sexual crime. Second, for increasing the conviction rate, high standard of proof is required by the criminal justice system. Prevention of sexual crimes is very, very high on national agenda. Rape crisis centers are in the process of being set up across the country. As the government sets up these dedicated centers for the survivors of sexual abuse, more and more doctors must empower themselves with expertise in medical and forensic examination. We, the medical fraternity, must ensure that no perpetrator of sexual crime should go scot-free just because of lack of training of doctors and because of the badly conducted medical examination. North India Gynecologist Forum, Delhi Gynecologist Forum, and Indian Medical Association hope that you all appreciate this film aimed at imparting quality content to the medical fraternity across India. Thank you.
Saiti, I think okay. So, yes, over to Sangeeta ma'am and Angela ma'am and Neena Bell ma'am.
Yeah, excellent presentation.
Yes.
I just hope and wish and pray that none of us have to do this examination for any unfortunate girl ever. But if required, at least the 37 people who are here are well equipped now mentally to go through the process. But I would like to make one point here that I once had the misfortune of examining such a girl and was called in Saket court. One should remember always that the lawyers there, when they cross-examine you, they try to put words in your mouth. What, in your opinion, could have been? What could have caused this? So always remember, even though you remember the whole case, the entire history and the time when you saw this patient, but do not say even one word extra from what you have documented on your prescription. It is very important because they try to put word in your mouth. Right now, we are just doing the examination. So most of us won't encounter this, but when we encounter this, we would remember and recall these patients. But still, don't let them put words in your mouth. That is important.
I can add something to this. My experience in court, like you said, Neena. So, when he was asking me something, I was saying something else. And, they make the person type. There's a person sitting with a typewriter.
Yes.
It's all time. I don't know if it's changed now. And मैं कुछ कह रही थी और उसको वो कुछ और बोल रहा था.
और interpret कर रहे थे. Yes, exactly. That is what he spoke to me. That is how the law spoke to me. कि आप भाव पे न जाओ, आप भावार्थ समझो डॉक्टर साहब. मैंने बोला नहीं, मैं नहीं कुछ समझ रही, यही मैंने लिखा है, यही मैं बोलूंगी. I still remember that sentence.
मैं जो बोल रही थी उसको वो कुछ और कह के लिखवा रहा था, तो मैंने उसको कई बार रोका. I said, this is not what I'm saying. Please do not distort what I'm saying and make him write or type what you want. So I had to stop him many times that this is exactly what I'm not saying.
Yeah, he asked me कि आपने कितने टिश्यू पेपर से उसका ब्लड साफ किया था और वो आपने डस्टबिन में कितने टिश्यू पेपर फेंके थे. So I said I can't comment because I can't recall. I can recall what I've written on the paper.
We have to stick to what is written.
Absolutely.
And any questions or?
Ma'am, can I say something?
Yes.
Whatever they record it in the paper, the police people, but then you have to sign it. Okay, whatever is written on the paper, it is with your permission and it is acknowledged by you. So without your signature, they cannot take it as an evidence. That is what I...
Yes, you have to sign it. And I just wanted to ask one thing, that in the presentation, it was that the picture has to be clicked. Who is going to click that picture, that bite mark picture? The doctor is supposed to take on their own time, or the hospital administrative people?
As far as the bite marks are concerned, if we should have all the arrangements, because if the things are available with us, the procedure is not at all difficult. We can take the bite marks, no problem. But if you don't feel like, you don't feel comfortable, you can ask, you can call a dentist. But so many people involvement is not right. So I think we can do it.
Sangeeta ma'am, just another question, like regarding the age group.
Who will click the pictures? You take it from your mobile phone. There
is in the kit, along with the kit, you have to have a mobile camera, a short camera, mobile camera. Either you can take the click, or we have kept a camera in our examination kit. जो कि परमानेंट हॉस्पिटल में रखा रहता है, छोटे वाला जो कैमरा होता है, उससे आप पिक्चर लो और लोड कर दो, कोई दिक्कत नहीं। उसमें कोई ऑफिशियल प्रॉब्लम नहीं है। यू हैव टू हैव द पिक्चर्स, चाहे किसी भी कैमरे से लो आप।
Now there are dedicated rape crisis center available,
Yeah.
and I think majority of the time police takes these victims on those places.
One
It is
stop
by
center.
chance, in case if you happen to examine them, this safe kit will be available, and probably it will not have that kind of a facility. Somebody asked me a question where this particular film is loaded. This film is on the IMA website. This is on an NIGF website. This is on DGF website. We have given to Director General of Health Services, Delhi government, and we have said that you pass on this particular thing to each and every medical officer. In the similar way, everybody, Dr. Raj will be responsible. Everybody who wants this particular thing to be given, we will send it across to you. You give a name registered, we will definitely send it across on your dedicated email on a Google Drive.
I just want to comment one thing, that we made this film in 2006. तब टेक्नोलॉजी इतनी एडवांस नहीं थी. We know कि हमने कैसे ये पिक्चर बनाई थी, पर आज के टाइम पे हमने बहुत सोचा कि हम इस फिल्म को रीशूट करें, but it was very expensive. So some basic things are loaded in the film which might appear कि अरे इसको और बेटर तरीके से कर सकते थे, but then हमने अपनी टेक्नोलॉजी जो उस वक्त हमारे पास अवेलेबल थी, हमने उसको यूज किया. एंड आज की डेट में ये फिल्म दोबारा बनाना इज वेरी वेरी डिफिकल्ट. एटलीस्ट
you will ask me, how much money we have spent this time. We are revising everything. We spent something like 25,000 rupees, and this is what we paid. So I think whatever you can see, he has Ranta Rajoria is a new person. That shooting and all that part has been here. We just spent 25,000 rupees, and that's it.
I don't think you need to make it again. It is very well done.
It is very well done.
It doesn't look like वो 2006 की है actually. The picture quality is very good. It is very clear. You have shown where to take the specimen very clearly. I don't think it needs to be remade.
And both Dr. Shada and Dr.
I was going to say
look
that.
the same.
The only thing is
so glamorous.
तो समझ ही नहीं आया ये suddenly
So glamorous.
जवान कैसे हो गए?
Yeah, the only problem is that you people are looking too young. That's the only problem with the film.
And I was about to ask them what kind of aesthetic treatment you have done.
Very true, very true. Everyone is looking so young and beautiful. Ma'am, there is a lot, a repeated question people are asking in the chat box, that from where do we get this safe kit? Because there are special dedicated hospitals, as you said, but what about the private hospitals? Is it mandatory for them?
Let me suggest you. What I had suggested to Dr. Sangeeta, that there are 10 forums, and it is government hospital does not need it because everybody has this particular kit. Now, as for the private hospitals are concerned, in East Delhi, big hospitals have it. Max Hospital has it. Everybody has it. But in a private practitioner, because POXO cases are going to come in detail with you people. So I think this kit should be available. Say in East Delhi, we have 2 kits available, and everybody knows this kit is available with Dr. Jain's clinic, and one can pick it up from this time to this time. This is the way the availability has to be made. आएंगे नहीं, but हमें prepare तो रहना ही पड़ेगा.
I will share with you the number of the person who supplies the kit, Dr. Shalini. You can circulate it further, or you can talk to him.
Madam, you can buy it from your account. आप वहां से लेके 2 जगह अवेलेबल करा दो और रोज डाल दीजिए कि यहाँ पर ये अवेलेबल है किट. खत्म होगी बात. कोई मुश्किल की बात ही नहीं है मैडम.
Would suggest if you can share that number in the chat box so that the people who are asking.
I cannot share in the chat box because there are so many distributors, and how can I share the number of one?
Okay.
I can share it you because जैसे हम अपने hospital में मंगाते हैं, I have got that number.
Okay, sure. And another thing I wanted to ask, ma'am, regarding the age proof, you said is it mandatory to take the radiographs, the dental imprints, or because these days we have Aadhaar card as an address or an age proof, would that suffice?
So there are 2 things you have made. The dental imprints are taken for the bites to tell the bytes. That is not for age estimation. Age estimation, now it has become more important because POXO has been introduced. When we made this picture, then POXO का नाम की चीज कुछ भी नहीं थी. हमने केवल child trafficking पे फोकस करके किया कि भी child trafficking में उसकी एज कितनी है. But with the POXO, अगर आपके पास एज कंफर्मेशन है, दैट स्कूल 10th का सर्टिफिकेट है या उसके स्कूल का सर्टिफिकेट है या उसका ऑथराइज्ड आधार कार्ड है, तो आपको एज डिटर्मिनेशन नहीं करनी है एज पर द सुप्रीम कोर्ट जजमेंट. बट इफ यू आर इन डाउट, आपको कोई भी सस्पिशन लगता है, कोई भी डाउट लगता है, या पुलिस आपसे स्पेसिफिकली कहती है कि नहीं हमें एज डिटर्मिनेशन चाहिए, द सेम प्रोसेस हैज टू बी अडॉप्टेड फॉर एज डिटर्मिनेशन. And those all x-rays and those all have to be taken. And if you are sitting in a hospital, you can take the help of your radiologist and other persons who can help you in determination of age.
Okay, thank you, ma'am. And
Doctor, now no more, any hospital can take it casually. It is an urgency, and even a medical superintendent involved into it. So you have to do it very meticulously.
Agree, ma'am. Agree. There is another question in the chat box. If pregnant minor, like 16 to 18 years, and her parents refuse for police verification, then still do we need to do PI?
But there is a difference between PI and MLC. In every POXO case, we have to make a MLC. हमको अपनी तरफ से MLC बनानी है, फिर वो पुलिस वाला आके उससे अपने आप relative से बात करेगा where they want to proceed or not. But as far as if you see any pregnant girl less than 18 years reporting to you, you have to make a MLC. Very clear.
There is another question. It says if one doesn't have a safe kit, what to do? Suppose आपके patient आ गए और अब नहीं है, तो क्या आप swabs ले सकते हो? Routine?
Yes, you can take, but the process has to be followed. Whatever we have shown in the film,
you have to see
step by step process, and mandatory specimens you have to collect.
Right. Yeah. So you can still do that and put in proper sealed bags and send it to the appropriate authority.
No
Doctor, I am not going to divulge the name. Senior people of government medical colleges are involved into legal cases because of, samples not collected properly, not kept in the fridge, that kind of things are there. So, this has to be taken very seriously. And that's why there is a training, retraining has to take place. And these exercise which we are doing it, this film will be available with any one of you. And you can keep it with yourself. So you cannot say that you do not know medical examination.
Today only we repeated thrice. The important things we have repeated thrice. Once by me, then by Madam in the film, and then certain points shown in the film and repeated by Dr. Anita. The purpose was only that major points वो बिल्कुल imprint हो जाए हमारे दिमाग में कि हम उनको नहीं भूलें या घबराए नहीं जब patient हमारे पास आए. Main point is that.
And one more question, ma'am. The presentation shows that even the colposcopy...
POXO cases, once you've informed the police, you go through go with the process of MTP. The only difference of an MTP in POXO case is this: the sample has to also go for a DNA. That part must not be forgotten.
Exactly.
Yes.
Yes, Shalini.
Yeah. Ma'am, I was asking, after the detailed examination, we have taken various swabs and samples and clippings. Is the examination what you showed by the colposcopy or by the Tolidine blue test, that is also mandatory?
No, that is not mandatory at all. That is only in special cases where, sometimes it happens that आपको डाउट हो रहा होता है या वो हिस्ट्री इतनी सजेस्टिव होती है या पेशेंट कहती है कि नहीं मेरे साथ फोर्स इंटरकोर्स हुआ और आपको कोई इंजरी नहीं दिख रही है, कुछ नहीं दिख रही है, तो आई थिंक if you can go into finer details with the help of these special investigations, the victim will be helped in the court, because हमारा पर्पस ये है कि हम इस किसी भी तरह से एविडेंस ऐसे कलेक्ट करें, if there is a possibility that we can collect the evidence, then we should go into finer details.
आपको कोई स्टेन दिखाई दे रहा है तो आपने सेलाइन उसमें लगा के डिस्टिल वाटर लगा के स्वैब ले लेनी है, वो उससे करने से लैम्प से है कि भी थोड़ा सा ज्यादा बढ़िया दिखाई देता है. That is dedicated rape crisis center has been made across, and हर बाजू में rape crisis center है. So I think, we people are totally ignorant who are working in the private sector. What's happening in the government sector? Government sector अब हमारे से बढ़िया हो गया है.
Ma'am, one-stop centers are there and they are taking good care of the patient. But only thing is, as per the law, you cannot refuse the examination. So once in a while, if you come across such cases, you should be prepared. हमें डरना नहीं है कि हम नहीं कर सकते. We should be prepared. That's all.
Agree. That video is so comprehensive. Yeah. I guess it guides you each and every step, especially the last part, where in each clip they show very short, like last 4-5 minutes, they show just the recap of the entire video. Step 1, step 2, step 3. That is very comprehensive, very nicely made, ma'am. And I think we all must have this video ready with us. Any more questions?
The court's question is time and again. आपने क्यों नहीं ठीक से एग्जामिन किया जब आपके पास फिल्म भी अवेलेबल है, सब कुछ अवेलेबल है. They say like this.
And what are the isolated centers by the government, ma'am? Which are the government centers?
One-stop centers.
मैडम, अभी ये जो सुप्रीम कोर्ट का ऑर्डर आया था ना, उसमें प्राइवेट हॉस्पिटल, जितने भी छोटे मोटे भी प्राइवेट हॉस्पिटल, जितने भी छोटे मोटे गवर्नमेंट हॉस्पिटल है, यहाँ तक आई हॉस्पिटल में भी उन्होंने ये सर्कुलर भेजा था कि आप अपने स्टाफ को ये रीट्रेन करिए as far as the examination part is concerned. Not only train, you must retrain on a regular basis.
Okay. Yes, this needs repeated emphasis so that we don't forget anything.
मैडम, आपको
काम
जो भी मांगे उनको भिजवा दो बस.
और सेफ किट अगर सबके पास होगा तो हमें कोई भी दिक्कत नहीं है, बिकॉज इट इज सेल्फ एक्सप्लेनेटरी एंड सेल्फ डायरेक्टिव. आप उसको एक एक स्टेप को करते जाओगे, आपको कहीं कोई प्रॉब्लम आने का मतलब ही नहीं.
मैं डॉक्टर मीनाक्षी के लिए कह रही हूँ, डॉक्टर मीनाक्षी, you have to see to it all medical colleges in city of Delhi contact their head of the department of forensic department or gynae department and see to it right in the undergraduate should be shown.
ठीक है मैम.
एंड सेकेंडली ओपिनियन मेकिंग में अगर हमें थोड़ी सी भी प्रॉब्लम होती है तो इसमें गाइडलाइंस में चार्ट्स दिए हुए हैं. उस चार्ट्स को आप अपनी कैजुअलिटी में डिस्प्ले करिए कि अगर खाली फिजिकल इंजरी है, खाली लोकल इंजरी है या फिजिकल और इंजरी दोनों है, तो किस तरह से हमको उसको opinion करना है. The charts are given in the guidelines in a beautiful manner, so we can have the copy of those charts and stick it into the casualty or our examination room. But every hospital should have a dedicated examination room for sexually assaulted victims.
Not only that, like we have a sometime HIV case or hepatitis B or hepatitis C case, we have given the numbers of Ruby, Bansal and things like that. So similar way, 4-5 numbers we will give it to you in case if you have any difficulty in making an opinion, all contacts and so forth.
Yeah.
So I think we will have a dedicated people. It will be available time and again. We will be giving them a reference and they will be there on the website also.
And post-exposure HIV prophylaxis too is to be given, ma'am?
Yes, if they,
madam, the tests are done these days, and I'm sure the tests are available on the same day. If you find things are positive, then also it has to be given. And if things are not positive, then patient should be asked. She can be, in that particular phase. Because this lady, in case she has not been exposed earlier, if she wants it to be done, it should be done.
You have to have the high risk history. If the history is high risk, then on a high risk case, you have to give this thing. Based on the history, you see कि ये high risk है, इसको इस तरह की है, ये history दे रही है, there are chances. Then you have to give as per the latest NACO guidelines.
डॉक्टर साहब, जो भी चीज आप नहीं करोगे लिखना पड़ेगा, नहीं किया ये वाला.
हाँ. Madam, it is must to write the follow-up visit. That is equally important.
Yes. Concluding remarks from you, Raj ma'am. Ma'am, you're muted. Ma'am, you're muted.
See, everything has been so well explained by the film and by the deliberation done by Dr. Sangeeta, and then added by the end concluding 5 or 10 steps in the film. I think everyone must have been now well trained, at least to do the examination properly, to collect the evidence properly, how to see, what to document. I don't think it needs any more further elaboration.
So, Shalini, I have to only request one thing.
Yes, ma'am.
You have done today effort, and quite a few people have attended. I could see a couple of people from East Delhi also have attended it. You have to do it every 6 months, so your job is done. I mean, train and retrain.
Sure. We'll do this repeatedly. And with this, I take this opportunity to thank the mentors, Shraddha Jain ma'am, Raj Bokaria ma'am, Sangeeta ma'am, Renu ma'am, and the chairpersons for this, Dr. Meenakshi ma'am, Angela ma'am, and Dr. Neena Bhel ma'am. And I hope I have taken everybody's name, and especially the back-end team from the Shield who have given us this platform. There were people who had joined on YouTube also. Sahiti, can you tell us how many people joined on YouTube also?
More than 50 members has joined from YouTube.
Okay, so I mean, people are quite interested to learn more and more about this. And with this, we wind up this session, and we hope to do this session at regular intervals. So
Thanks, Dr.
thank
Renu.
you.
Thanks, Shalini.
The next time it should be in continuation to the POXO Act, because these two are interconnected.
Yeah.
Yes.
Okay.
Thank you, Raj.
So much. Thank you, everybody, for joining. Thank you, Sharda ma'am. Thank you, Dr. Sangeeta, Dr. Raj, and everybody.
Thank you, everyone, for allowing
Special
us.
thanks to Raj ma'am also. Ma'am is the chairperson of the medical legal cell of the Delhi Gynae
Madam Shada.
I must tell you that Raj has been doing this work dedicatedly for the last 2 decades. She has suffered herself, and that's why she had taken up this particular thing. And I will say that in sincerity, nobody can match her. So I think things are becoming very popular, and now the medical legal issues have become important, because roughly 2.5 to 3 cases are there against every gynecologist. Majority of the people feel shy away and do not declare it. But people like us who have been experts in Delhi Medical Council, and now with the National Medical Council, we know that more than 50% cases are against gynecologists. And I think these kind of things are very much required. I will still say that any kind of help anybody requires, if they have medical legal cases against them, we have almost 30 professionals trained in Delhi who can definitely help you. And time and again, we can declare the list. And otherwise, Raj is one person. In different areas of the city, we have trained people there. So I'm sure they can collect, but all we people are always available.
And now we are starting this NIGF, also in NIGF, we are starting this Kanun Ki Pathsala on every second Thursday of month. And yesterday was the first one, the opening session was.
And as far as ours is concerned, Delhi, it is always on 21st, 7:30 in the night till 9:30.
Great initiative, ma'am.
21st of the month. Yeah. Dr. Madam Garima, ये बताओ, Garima Prasad, आपने सुना कैसा लगा आपको?
Ma'am, I think it was awesome, and any session conducted under your chairmanship has to be wonderful.
No, I was just liking, you are not a medical person.
No, I'm not a medical. So, ma'am, ये इतनी useful थी, because now my responsibility along with my medical superintendent here becomes to train all our people, because I think the frontliners, security, everybody has to also understand the process rather than refusing the patient or anything. So the medical people will do the examination and things, but it is equally important for the non-medical people to understand the process. As hospital administrators, I think now our responsibility increases and we have to follow this. So
we can probably have
एक साल की पेनल्टी है, एक साल की जेल है और पेनल्टी है. गायनोकोलॉजिस्ट को थोड़ा बहुत पता है, पीडियाट्रिशियन को तो बिल्कुल नहीं मालूम है. और वो जब टाला-टाली करते हैं तो फिर तो उनका प्रैक्टिस भी जाती है और जेल में भी जाती है अलग.
Absolutely. I think it is very important for the hospital administrators to have this knowledge and help.
Shalini, it is responsibility of yours. आप administrator की बात भूल जाओ. पहले तो आपको आया कि नहीं आया, बस हमें तो अपने से मतलब.
हाँ जी मैम, ये वीडियो इतनी अच्छी है कि
patient can come to your clinic also, so you should know.
Yeah, true. I've shared my number. I'll take the number of the dealers from Dr. Sangeeta Gupta. Whoever needs it, and anyone can contact either of the Dr.
Madam,
Sangeeta.
आपके पास फिल्म है, उसको आपको Google Drive में भेजना है, बस पहुंच जाएगी उनके पास.
ठीक है ma'am, ठीक. Thank you so much, ma'am. And with this, we take the permission to leave, ma'am. And
thanks
it
once
was an
again,
excellent webinar.
and Dr. Renu.
Thank you. Thank you.